Good evening and welcome to our COVID-19 update studio. I'm Neota Egbe and here are the highlights. Nigeria Customs arrests 6 persons over attacks on facilities in the wake of looting of palliatives at the Gwagwalada warehouse. Zamfara state government warns residents on strict adherence to COVID-19 protocols, says pandemic curve has been flattened in the state. Traffic around Paris hits record high just hours before a new national lockdown comes into force across France, just as the US sees record highs daily numbers. Six persons have been arrested for the attack on the training facility of the Nigeria Customs Service situated in Gwagwalada. Just last week, rampaging youth in their numbers attacked government facilities in Federal Capital Territory in search of palliatives. Speaking with journalists after a tour of the Nigerian Customs Training College in Abuja, the commandant of the college, Mr. Adewale Adeniyi, explains that those arrested have been handed over to the Nigeria police for further investigation.
The past 1 week has seen businesses and government organizations counting their losses over attacks by rampaging youth. One of the facilities that came under attack is a warehouse where palliatives were stored in Gwagwalada. The warehouse borders the training command of the Nigerian Customs Service, and that was not spared during the attack. The commandant of the college narrates how youth numbering over 4,000 insisted on looting the facility.
It will not be conclusive for me to draw such conclusions yet, but we are certain that those who came to us were hoodlums, because we managed to convince them that we didn't have anything here. But I agree with you that those who came may be drawing some kind of inspiration and encouragement from the successes they have recorded in some other places, not just in customs locations, but in other facilities owned by the federal government of Nigeria.
The training command is back to normal as the commandant leads officers and journalists to see the impact of the damage on the facility. Shattered glass and bullet holes were some of the destruction caused by the rampaging youth.
Clearly, when people come to your fence, if you are demonstrating or you are protesting, and you come and dig holes on the fence or create this kind of damage, this is a clear violation of our space. This is no longer protest. We treated this as, people who came with the intention to steal, with the intention to harm us. And we have students here, we have staff here. We could not allow them to come and violate our security, so we had to respond appropriately.
While investigations are on, officers of the Nigerian Customs Service are calling on Nigerians to desist from acts capable of breaching peace.
And in Taraba State, the government says it will not spare anyone involved in looting government and private property in the state, except if they return them to the nearest authority. The state's Deputy Governor Haruna Manu says every looted item must be returned, as the looting has gone beyond the COVID-19 palliatives to pilfering. A 100-bed space isolation center, the NYC orientation camp, as well as a bio-resource center were all vandalized by looters.
Following the looting spree that greeted warehouses, government organizations, as well as private schools in Taraba State, the Deputy Governor embarks on an on-the-spot assessment of the facilities. His first port of call is the Bio-Resource Center, a federal agency that trains youths in various skills. The state NYC orientation camp, which houses a COVID-19 isolation center, is not spared. The intervention of the army stopped the rampaging youths from vandalizing the entire facility.
Around 11:14 p.m., some hoodlums came in, thousands, with cutlass, hoe. Some were holding guns, and a lot of vehicles We even have some of the plate number with us. Came in, they pack all our machines, they pack all our chairs, they vandalize everything in this center.
So they vandalize almost everything. They pack our mattresses, pack all the beds in the isolation center, remove the ceiling fans, the khaki uniforms, the boots, the canvas, the PT uniform, all the cooking utensils, including freezers, office furnitures, almost virtually everything.
Baffled by the incident, the State Deputy Governor Haruna Manu warns of dire consequences if the stolen properties are not returned.
I want to use this medium to still call upon those that looted these properties to return them, because if they don't, government will descend on them, and then will descend on them heavily. I want to assure them. So it is in their best interest, those that carted away these properties, they should return them.
Recovery from this is a huge task, and the Speaker of the State House of Assembly is promising to support the government as it works out plans to help deal with the situation.
There will be a collaboration between the state assemblies and the National Assembly, perhaps maybe the Conference of Speakers and the National Assembly, to see how we can come up with a law that will tackle these kind of issues.
No fewer than 15 government and private facilities were vandalized in the wake of the looting following the NSAS protest in Taraba State.
Staying in Taraba State, the government has inaugurated an 11-man task force to recover all of these items that were looted, as well as assess the level of damage done on both private and public property in the 4 local government areas of the state. The rationale behind the constitution of the committee, according to the state government, is to right the wrongs of the rampaging youth between 24th and the 27th of October. The committee, which will be led by retired Lieutenant Colonel Nashuka Tukura, have been encouraged to work within the ambit of the law and constitution of the country and identify all persons who aided or abated looting in the state. The committee, which was inaugurated by the state's deputy governor, will also identify casualties, recommend the way forward, and tender its report within 14 days from the day of inauguration.
Out of the genuine concern by the government to right all the wrongs, government has decided to set up this task force committee, which I hereby constitute on behalf of the executive governor, Architect Darius Dixon Ishaku, to recover all looted items from public and private offices or receiving surrendered items in the state with a view to restoring them to their rightful owners who have fallen victims to these attacks.
In Cross River State, the government says it's devastated by the wanton destruction of the state's archival materials dating back decades in the wake of the NSAS protest. The State's Commissioner for Information and Orientation, Asu Okang, says some of the items lost may never be recovered. Meanwhile, the state government has condemned the looting of the World Health Organization's office and other health facilities in the state.
Just when you think you've seen enough of the devastation in Cross River State following the NSAS protest, then come these sights. This is what is left of the state government's printing press, where printing machines worth millions of naira were vandalized and set ablaze. In another section of the building, archival materials, gazettes and other historical documents are in ruins. The State's Commissioner for Information and Orientation, Mr. Asu Okang, in company of management staff from the ministry, is in shock over the level of damage.
It is very unfortunate, it is saddening, it is sickening. What has been lost here may never be recovered. Never. Never be recovered. I am most saddened by the fact that the entire archival materials, the institutional memory of chronicle of the state is completely gone. Anybody with a useful information, please get to us. we will fish them out.
Also destroyed is the Nigerian Chronicles, which is said to be the oldest surviving newspaper organization in Cross River State, and the Nigerian Television Authority, Calabar.
So sad. People who call themselves protesters, whereas I call them vandals, criminals, came, and that's the picture of what I have today. It's now history, because you can't put it back. To get these machines today is running into billions of naira, so we can't get it again, so that brought it back.
In a related development, the Cross River State government has condemned similar attacks on the office of the World Health Organization in Calabar, the state's essential drug store, COVID-19 reference laboratory, infectious disease hospital, and other health facilities in the state.
There is no single bed. In the IDH, there is no bed. In some of the primary healthcare facilities that was raided, there is no bed, no equipment, and all of that.
While the state government continues to carry out investigations on how the looting began, it's calling on those involved in the looting of both public and private properties to return the items in their possession or face the law when caught.
And a related story, the Akwa Ibom State government has described as baseless a report it attributes to the police public relations officer in Cross River State, linking the recent looting of private and public assets in Calabar, the Cross River State capital, to Akwa Ibom youth. A statement by the Commissioner for Information and Strategy, Inieme Mobong, says a large number of people could not have moved across the border, it's being alleged, through the waterways undetected, especially with the heavy security present on the coastal ways. He says the naval ships and other security agencies within the jurisdiction can attest that there was no such movement, describing the allegations as untrue and misleading. According to him, there's a clear distinction between an act committed by non-indigenous residents and that committed by people who are visiting for the purpose of committing crimes. The Zamfara State COVID-19 Task Force says it has tested 178 of the coronavirus pandemic recently, which all results returned negative. It has also sent some samples to Abuja, which the results are being awaited. The State's Commissioner for Health, Yahaya Kanoma, says while COVID-19 updates in the state to the channels where he appreciates the support and cooperation of stakeholders in the control of the spread of the coronavirus pandemic.
Presently, Zamfara State has no single positive case at both its temporary isolation center at Yarima Bakura Specialist Hospital and its Nigeria Center for Disease Control Certified Center located at Damba Community, a suburb of Gusau, the state capital, which is still under construction. At the State Secretariat, adherence with all COVID-19 protocols is compulsory before gaining entrance into the building. The Yarima Bakura Specialist Hospital and the Federal Medical Center, both at the state capital, are the two samples collection centers for onward transfer to Abuja for testing. The State Commissioner for Health, Yahaya Kanoma, explains that the task force is not resting on its oars as it continues to provide enlightenment to the people on the need to adhere to COVID-19 guidelines.
Zamfara, we are still index 0. Some 2 weeks ago, we have tested across the states. We have tested 178 people across the state, and all the result was sent to Abuja, and the results come back negative. And also before that one, there are some ulamas from the states that want to go to Kaulaha, Mali. 57 of them, we have tested them, and all their result is negative. We have some students that are going for study in abroad in Cyprus, and they are all tested. 27 of them, and they are all negative.
Mr. Kanoma points out some of the successes recorded in curtailing the spread of the coronavirus pandemic in the state, saying it is as a result of unending provision of financial resources, equipment and support by the state government of the task force to enable them carry out their assignment with ease.
We have seen the dividends of sensitization, mobilizations with all sector of people, That is our traditional institutions, the ulama groups, and Christian association, and some charity groups, and some of our NGOs that are working and partners that are working in the state. We amalgamate ourselves in one place for continuous sensitization in the state. First, we define what is that COVID, and people accept it and they understand the definition, so that what makes us to succeed.
Meanwhile, a resident claims the milestone achieved is a result of residents' observance of precautionary measures, which was made known to them through public enlightenment.
This government keep on what they are doing now, because any negligence concerning this COVID-19 will be experienced back again. But as far as they continue with what they are doing to observe all the guidelines given by the NCDC, right? So I think we will not experience COVID-19 in the state again.
A total number of 78 infections have been recorded so far in Zamfara State, and all the patients have been discharged. Though the state government says it has flattened the curve of the virus and is prepared to deal with any upsurge in cases in the state, residents are warned not to throw caution to the wind, but continue to observe all COVID-19 protocols.
The federal government has lifted the ban on contact sports in Nigeria, prompting many sports federations to step up plans to resume their activities. The pandemic raised unique questions with respect to whether transmission of COVID-19 will become an inherent risk during the contact sport. And this next report looks at the mindset of the stakeholders as contact sporting activities resume in the country.
Athletes begin training again in non-contact sports after months of inactivity caused by COVID-19. Based on recent pronouncements, contact sports will be back in a few weeks.
We hope in the next 2 weeks, contact sports can also return, subject to the strict adherence to COVID-19 protocols.
Stakeholders eagerly anticipate a return of contact sports as the country adapts to the new normal.
If all the states are practicing, are doing sports, then a whole industry is reawakened gradually, and hopefully we can get to a point where we're all back at what we know how to do best. So let's practice what the new normal is. Let's get used to what we should be doing whenever we are doing sports under this new atmosphere, so to speak.
Among sports fans, the issue divides opinion.
I want contact sport to return if we are able to protect the players and to be able to manage the situation so as not to allow COVID-19 to spread further.
I think we are ready also to face those protocols. So I think we want it to be back. We can handle it. We can handle it.
Health experts warn that the well-being and safety of athletes must be top priority, while the health crisis is still on.
To begin to think of resuming contact sports, especially like football, it's not a bad idea. But however, we cannot put our feet off the feather. We need to keep on applying all the safety precautions so that we don't have our hands full at the end of the day.
No doubt, keeping athletes involved in contact sports safe during this COVID-19 era will certainly be a big challenge.
When the COVID-19 studios return, we'll be looking at what the effects of COVID-19 has on the sports scene, especially since sporting activities resumed across the country. We'll be talking to a sports journalist who joins us from Paris, France. That'll be in a moment. You stay with us. Thank you for staying with us. Now, before we end on that break, we listened to the thoughts of a couple of people who are concerned about the effects of COVID-19 in the sporting world. But we have joining us from Paris, France, Babatunde Ojora, who's a sports journalist. Babatunde, So far, since the resumption of contact sports like football in France, how has it been? How's it been like in the sporting world over there?
Good evening, or should I say bonjour? Thank you for having me this evening. It's a new normal, but it's something we just have to learn to live with now. Before you get into the stadium, since the reopen of contact sports, like let's take football for example, they have to check your temperature, and after that, you get into the stadium with they have guidelines where you have to pass through. You don't go through. They have a special place for going in now and for coming in. That's for it. And also, after the first 45 minutes, we'll see people going out to get food, to get refreshments. We don't have that anymore since reopening of contact sport football. We don't have that. Now we have food vendors that will come to you before the end of the first 45 minutes, in a way to try to minimize movement in the stadium. So it hasn't been easy. It's not like we used to, how we used to see it, but we are learning to live with it.
Yes, the restrictions were lifted somewhat to allow some sporting activities to return, but then you see that the numbers have continued to increase and new restrictions are coming into place. Do you think they will in any way affect sporting activities anymore?
Sure, it's true. We're actually waiting for how contact sports will react to what President Emmanuel Macron announced on Wednesday, that we have to go on lockdown. As of today, we're now on lockdown. So it will affect it. Even as at this morning, I got a mail from Paris FC for a game I was supposed to cover tomorrow. Sorry, I beg your pardon. They said the game will now be played behind closed doors. We won't be open. We won't have journalists. We won't have fans. It will just be the players and the officials for tomorrow. So it's going to affect it.
But then, do you think any other new measures will be put in place besides the ones we already know? Fewer numbers in the stadium are now completely closed out. Are we expecting newer measures for both the players, the officials, and you already told us journalists are not coming to any games anymore?
Yeah, there will be, obviously. When they reopen football activities, contact sport, the players, the ones I happen to speak with, they go on COVID-19 tests every week, mostly before game and after game, and 3 days after training. So now it will be like probably every two days because of new cases and deaths and everything as a result of COVID-19. So there will be new measures, like we can't get into the stadium. Even then, I could remember then after checking your temperature, they will still make sure you have to sit like a stadium that can contain 40,000. Then, like Nantes, the stadium can sit over 37,000, but then it was like 3,000. We still have, high cases and new cases. So they will try and, as much as possible, like I said earlier, on Paris FC won't have anybody. So that means for now, there won't be people coming to the stadium. And like the president announced on Wednesday, you must not live beyond 1 kilometer to wherever you live. You can't do that. So that means even for these players, for these athletes, probably the team boss now will have to go and pick them in their house, get them to the stadium after the game, take everybody back. Just, it's going to be a crazy new world, but we are waiting to see how it goes on.
But before this fresh lockdown and the new restrictions that are coming into place, how often were the players and officials tested?
They get to test them 3 days intervals, I think. They test them before the game and after the game. Then 3 days after the first training. Because after a game, they go for 1 or 2 days break. I don't know how it is. But here in France, after the game, they go 1-2 days break. And within that time, the players probably would have gone somewhere and contact the virus. So when you get back, or when they resume training back, they test them again. Okay. After that, a day before the game as well, they'll still test them.
Okay, seeing that now that the numbers have spiked and new restrictions are coming in, but here in Nigeria, in the next couple of days, contact sports will start off. And we heard some respondents tell us how they've been longing for contact sports to start. Are there some precautions that should be taken here?
Wow, a lot. Like the guidelines I mentioned earlier on. First and foremost, you check the person's temperature, the person's temperature coming into the stadium. One. Secondly, you sit people not 1 meter apart. You don't make them sit together. You don't have people just jump back like where you could have 5 now. Before in France, so you could have 5, 6 people sit. It's 2 now. They can't do that as well. And also, when the game reopened, we were not allowed mid-zone as journalists. You only have the press conference for the coach and maybe a player or 2. No more mid-zone. So I think that also should be done to kind of minimize the movement and contact of people, getting in touch with this player. So they can also do that. And I think the one thing I like about all this is the refreshment part. Because there's no way people get into a stadium, you want to, after the first 45 minutes, you want to eat, you want to mingle, you want to talk. It's no more there. We are missing it, but we just have to follow all these guidelines and make sure before the year ends out, hopefully we'll get a vaccine to make us return back to the normal bubbling football, because it's not interesting. I won't lie to you. We are not having fans. Even the fans, you don't see fans jubilate like they used to do, come together, the noise. So we are missing all that.
The hugging and the fist bumping and all of that is no more, right?
You are missing it. It's no more. And there are some teams. I remember speaking to a player that told me whenever they are visiting Dortmund, Signal Iduna Park, you can feel the fans and the fans. The wall itself is like the 13th man or the 12th man, to a team. But now you don't have it. So it's an advantage to teams like that coming from away, sadly. So you were missing it.
It's real sad. Let's hope that things get back to normal as quickly as possible. Thank you so much. Babatunde Ajora, sports journalist who spoke to us from Paris, France. Let's hope that things work out real quick.
Thank you for having me.
150 new confirmed COVID-19 cases from 9 states and 2 deaths were recorded in the last 24 hours. A look at the breakdown right there on your screen. Lagos still leads with 89 new cases. Rivers, 19. Ogun has 11. Bayelsa, 9. Kaduna and Plateau recorded 8 new cases each, while Taraba reported 3. Osun State has 2 and Delta has 1. These brings the total number of confirmed cases to 62,521. But there are 3,131 active cases, while 58,249 people have been discharged and 1,141 lost their lives. South Africa's President Cyril Ramaphosa is expected to address the nation on the next steps of the country in the fight against COVID-19. This comes amid speculations that the country could return to harder lockdowns should the numbers continue to rise. South Africa is hardest hit African country and stands at number 12 on the global COVID-19 figures ranking with 4.8 million tests done, over 720,000 people positive, but recovery rate stands at 90%. Here's Betty Dibia, our South Africa Bureau Chief, to tell us more.
Global comparative COVID-19 data has shown that African countries seem to be faring much better than most others, especially those in the Northern Hemisphere, in terms of the key COVID numbers. This has left more scientists baffled. And some wonder, could it be the handling on the continent?
I'm not sure I agree with Africa's handled it well. I would rather say Africa has had a COVID-19 epidemic that is much less severe than we expected. Whether it's because of something we did or something that we had as a benefit or some conditions that applied that led to this. So I think there are possibly some biological reasons, there are possibly some organizational reasons, but I think one of the things that may have contributed is the very early actions that were taken in a lot of the countries in Africa.
The way we manage that part, that other side of it, the livelihood of people, is going to determine how severe the next wave, if we do have the second wave, which is a likelihood, but it may become more severe depending on how much we have relieved the livelihood. If we don't have a process in place for adaptation to relieve livelihood, when the second wave comes, people are just not just going to stay at home.
Within Africa, South Africa is the worst hit, although some scientists believe the high number of tests done is higher than those recorded in other African countries, which makes South Africa's picture much clearer.
If you don't have that data, you're not doing enough tests, you should not feel comfortable because you might have a very big blind spot. So it's almost like you're looking here in front of you, but you're forgetting to look left and right. And then because you're not doing that, you might then be surprised that you become overwhelmed.
With seeming COVID fatigue in the air, numbers in South Africa are fluctuating these days more northwards than south, while the Premier of KwaZulu-Natal, Sihle Zikalala, has threatened that a return to a harder lockdown may be resorted to if people do not adhere to health safety regulations, and he's not alone. President Cyril Ramaphosa has rubbished such talk as alarmist, but admitted that government is worried that things may get worse if people do not act better.
COVID-19 is serious. It is a serious condition, and we all need to adhere to those measures, particularly now, as a nation we move towards that fun period of December, where people will let their guard down.
President Cyril Ramaphosa is expected to speak to the nation in a few days' time on what needs to be done next, after studying a report presented to Cabinet by the Medical Advisory Committee on COVID-19. From Johannesburg, South Africa, Betty Dibia for the COVID-19 update.
And here's Betty to shed a light on a couple of things, like some questions that a lot of people are wondering about. Hello, Betty.
Hello, Nelton. How are you?
I'm good. And how are you today?
Good, thank you.
It's good to know that you're good. So, Betsy, let's start up real quick. President Ramaphosa is still in self-isolation, right?
Yes, he is, and he's working remotely.
Okay, and I guess that's where he'll be addressing the nation from. But let's leave him and look at the other numbers here. Some of the respondents you spoke to mentioned a couple of things. I mean, with figures like over 700,000 positive cases, even though 90% of that's reportedly recovered. They're looking at the issues of lifestyle of Africans, and then someone else talks about the livelihood of Africans. So the lifestyle as against livelihood, which one should the Africans be looking at the more? Which one should carry the weight as we consider the possibility of a second wave of the coronavirus on the continent?
I guess it would be safe to say you have to have balance. You have to be alive to have your livelihood, and you need your livelihood to sustain your life. So it's just doing things, adhering, I wouldn't stop saying that, adhering to your own safety for you to be alive, to build an economy, and you need an economy to sustain lives. So if we're able to strike a balance, governments are pushing, but people need to listen and take responsibility. So it's just that balance, striking that balance, being able on the government side probably to take care of people. As Professor Ayo, the second professor in that report, Olaleko Yusuf, saying that the way it's managed, how you take care of people to sustain their livelihoods will determine how they'll respond to you as a government if there's a second wave. If they don't have anything to eat, when you're saying, please stay at home so that you'll be safe, they'll tell you, so stay at home and do what? So it's just being able to strike that balance effectively enough. That's just a responsibility on all sides, striking the balance.
But let's look at that, striking the balance, and again, putting that against the attitude of the African. I mean, the African appears to know what he wants and wants to go out there and get it, being a family person. You walk amongst them, and what kind of feedback do you get from the people as against what the government is saying? I mean, government's putting out one thing, but what's the feedback from the people in this place that we find ourselves?
Some areas you see people still in denial, and then when people hear such things as, oh, recovery rate is 90%, 90.3%, they'll say, okay, so it's not that bad. I've heard someone say, look, the risk is exaggerated, so let's just go about our lives and do our thing. So that makes it difficult for government to be listened to. You know, when you see that more people are recovering, if in case of South Africa, you have, as at today, 723,682 confirmed cases. Today, overnight, we had 1,912. And the recoveries, you have 653,052 cases. That's recoveries. We had overnight 66 fatalities, COVID-related fatalities. And we've come from where we were getting 10,000, 12,000 overnight or in a 24-hour cycle. And it's coming down. So people are saying, okay, that means it's not a death. People are not going to be dying overnight. But you know that this virus moves with the movement of people, or if you have what they call the super spreader events, which we're getting to. We already have some being recorded, people going to nightclubs and not obeying the curfew time, saying that, which says that everybody should be home by midnight. So over at the weekend, you had the police going around some nightclubs where you had, in a particular case in Sandton, here in Johannesburg, you had over 300 people, no masks, no social distancing, no physical distancing. So situations like that are super spreader events. Christmas is coming, you have church events happening, huge church reunions, family reunions, and all that. That's what's worrying government. If people are relaxing or they're just tired of hearing about COVID, you know, maybe they have to get more creative in passing the message and getting people to understand that COVID is still here. So it's in the hands of government and the hands of the people as well to know that COVID is still here and they have to keep safe.
All right, thank you very much. Our South Africa Bureau Chief, Betty Dibia, thank you. Just stay safe and keep us updated.
You too. Thank you so much.
All right. Now, let's go on to Germany, where the country is officially heading back into a second lockdown as the coronavirus cases surge to new records. It now joins the European neighbors, including France, to Italy, that are resorting to harsh new restrictions to combat the virus, threatening to break healthcare systems. Well, joining us is DW correspondent Chelsea Delany from Berlin, and here to give us an update. Hello, Chelsea. Let's start off real quick. The German government decided this week on a set of new restrictions called Lockdown Light. Can you just walk us through what this procedure is about?
Well, these restrictions are being called lockdown light, as you said, but they are still quite strict, and many people are already quite upset about the new lockdown. What we're going to see starting Monday when these new restrictions kick in are bars, cafes, restaurants close. We will still have schools open. Many workplaces will stay open, but this also will be a big blow to the cultural side of the economy. Operas, theaters, concert halls, all of that will close as well. This, of course, comes as Germany is seeing a very intense new wave of infections. We've been reporting here in Germany almost 20,000 new cases a day. This is much higher than the infection numbers we were reaching earlier in the year. But part of that, of course, is due to the big increase in testing. Still, this is a big challenge for the country. Many people had been warning, many public health experts had been warning over the past couple of months that the fall would be very difficult, the winter would be very difficult, but it's still a bit of a shock to the country. We likely will see these restrictions lasting through the end of the month. That's the plan right now. It is still a little bit lighter than the restrictions we saw earlier this year. Stores will be able to stay open, for example, and that's one of the main differences, but still a very challenging situation for the country.
Earlier about the impact of this light restriction as it is on the economy. But how severe will this damage be?
There's no doubt that these new measures will deal a blow to the economy, but how steep that blow will be is still very much up for discussion. Today, we heard from the economy minister here in Germany that they're still feeling quite confident in the economy, that the strength we saw over the summer should really help mitigate the blow we see going forward. They still expect the economy to contract a little over 5% for the year, but they haven't really revised those forecasts down much. And that's in part because we saw a very strong recovery in the economy in the third quarter, which we saw data for today. The German economy grew by about 8%, much stronger than expected. So that is helping. But of course, many industries will feel this disproportionately. We've seen forecasts, for example, that 1 in 3 hotels, 1 in 3 restaurants could face bankruptcy by the end of the year because of these new restrictions. And of course, there's still a lot of uncertainty over whether these measures will be enough to really contain this new outbreak that we're seeing. So there's a lot of uncertainty in the German economy right now. They've already, the German government has already pledged about 10 billion euros worth of support to businesses, and particularly small businesses and entrepreneurs who are losing a lot of business because of this. So they've pledged to cover about 75% of the lost business for these entrepreneurs. But already there's criticism that that's not going to go far enough. And of course, the heightened uncertainty could make people a little bit more hesitant to spend. So right now, the German government is signaling a lot of confidence in the German economy, but there are a lot of headwinds and a lot of potential negative impacts coming forward.
All right, thank you very much. DW correspondent Chelsea Delani joining us there from Berlin. Thank you. Please do stay safe. And now let's look at the global update. The U.S. saw a record high of 91,000 new COVID-19 cases reported on Thursday, with spikes in dozens of states just days before the presidential election. The same day, over 1,000 Americans died with the virus as the national death toll and number of patients in hospitals continued to trend upward. Over in Europe, France is now in a new national lockdown that will last at least a month as it aims to curb one of Europe's biggest coronavirus surges and ease the pressure on its hospitals. There were record traffic jams around Paris earlier, with many people heading for rural accommodation, but now the queues are much shorter. It comes as European authorities are scrambling to slow the spread of the coronavirus, which threatens to bring ailing health care systems to the brink of collapse. This is where we end our COVID-19 update program. We'd like to encourage you to visit our website to get channelstv.com for more updates on all safety protocols and to have a better understanding of what is required for you to stay safe. You could also check out our page for other stories in sports, business, and politics. Thank you so much for watching. Neota Egbe. Bye-bye.